Recording in progress.
So welcome once again to the CSC Development in Action webinar. Today's webinar will be on private eye health care in Nigeria and whether it's a key to SDG 3. This webinar will mark World Sight Day, which takes place tomorrow on 13th October. And the theme for this year for World Sight Day is hashtag Love Your Eyes. To deliver this webinar, I'm pleased to welcome Commonwealth alumnus Dr. Omojeme Adomi. Dr. Omojeme is a clinical optometrist with vast experience of working in private and public eye care sector. She is a low vision practitioner, heading the optics department and is the outreach director at one of the major eye hospitals in Nigeria. She's obtained her doctoral in optometry from the University of Benin, Nigeria in 2007. I'm also pleased to inform that Dr. Omojeme is a 2017 Commonwealth Distance Learning Scholar. She completed her MSc in Public Health at the University of Liverpool. I personally look forward to hearing more about her experience as an optometrist, but also about her experience as a distance learning scholar and how this helped her in building a career in this field. So without further ado now, over to you, Jimmy.
Hello, Eva. Thanks for that introduction. Good afternoon to everyone here. Thank you for joining us at this webinar. We'll just do a brief overview of what we're going to be talking about for this webinar. I'm going to talk a little bit on what my motivation was in pursuing a career in eye health. I'll speak a bit on what eye health is and what eye care is and the role of eye care in achieving the UN SDG goals. I'll talk about the private eye care versus the public eye care in Nigeria. And I'll talk a little bit on my Commonwealth scholarship experience. And so, as Eva has previously said, I have a Doctor of Optometry degree from the University of Benin. I have 15 years of experience in optometry in both public and private sector. I had the optometry department of St. Edmund's Eye Hospital in Lagos, Nigeria. I also have a certificate in low vision and a master's degree from the University of Liverpool, thanks to Commonwealth Scholarship Commission. I have published in journals and magazines and have presented at conferences and seminars on topics ranging from public health to eye health to low vision. And so this topic is particularly dear to my heart. And so I'll just start talking about my motivation. Why did I decide to go into the eye care field? And so I can never forget the day I got my first pair of glasses. I was 8 years old, and prior to that time, I had series of headaches, very bad headaches, and I had this really long hair, at least as long as those of us with kinky hair can get. I had really long, very full hair, and everyone was telling my parents that, oh, it's because her hair is too long, cut it. And so my parents cut my hair, and I didn't really care because all I wanted was for the headaches to stop. And so despite cutting my hair, the headaches continued, and someone just suggested to my parents, why don't you go and take her for an eye checkup? And I was taken for an eye checkup, and I was given a pair of glasses after the test. And when I wore my first pair of glasses, I can never forget. I was 8 years old then. It's like 30 years ago, but I can never forget what I said. I said, wow, is this how the world is? Like, I never knew that what I was seeing, which was all blurry, was just my vision. It wasn't how everyone was seeing. Like, I thought everyone was seeing as I was seeing. And so having that blur vision, I couldn't really appreciate a lot of things. But as I got my glasses, it changed my life. And I can confidently say that if I hadn't gotten my pair of glasses when I did, I don't think I would have achieved as much as I have. I don't even think I'll be here as at today. Another strong motivator for me has been my patients. You know, I see how committed they are to assessing, eye care, how they struggle to be able to even assess that care at all. And so I motivated to try and make eye care as accessible and as affordable for them. Another strong motivator for me is my daughter. My daughter is 7 and she's autistic. She has ADHD and she's nonverbal. And it's been a struggle in living in Nigeria, living in a low LMIC to access care for her. I really can't do much about that, but I can do something for persons who have visual issues, who have eye problems, who need eye care, and I can do something about helping them to access eye care. And so that motivates me. That even if I can't do much for my daughter, I can do something for someone out there. And so that takes us into our topic. I'll just want us to answer this poll quickly. Do you think private eye care is a key to achieving SDG 3? In your own opinion and in your own experience? So I'll just like us to get started with the webinar on that. And so, first of all, what is eye health? Eye health is so much more. I'm sure if you ask anyone, they'll tell you that, oh, eye health, it's just about eye diseases. Oh, it's just about vision. But eye health is so much more than just eye diseases and, and vision loss. Lancet Global Commission set up a commission on global eye health, and they define eye health as the state in which vision, ocular health, and functional ability is maximized. When we talk about functional ability, we're talking about no matter the level of vision you have, being able to maximize that vision, even if it's from 100 to 10%, being able to maximize that vision so that it contributes to the overall health and well-being of the individual, their social inclusion and quality of life, not just for an individual, for everyone, everywhere. So that is a more encompassing, explanation of what eye health is. And what is eye care? Eye care, as most people say, eye care of the eyes, treatment of the eye is much more than that. Eye care has to do with the full spectrum of comprehensive eye health, which is made up of promotion, prevention, treatment, and rehab. Unfortunately, most people focus on just the treatment aspect of eye care. Eye care has to do with promotion. Promotion refers to promoting things like contact lens hygiene messages in reducing corneal infection. It has to do with prevention, for example, increased time spent outdoors and decreased near work for children to slow down the progression of myopia and its complications. Comprehensive eye care also has to do with, as we all know, just the treatment which everyone knows, which is use of eye drops, tablets, surgery, glasses or contact lenses, and rehab. Rehab has to do with providing and training people on how to use reading devices, assistive devices, orientation and mobility training. But unfortunately, these other 3 areas, promotion, prevention, and rehab, are not really focused on. Most focus on when people talk about eye care is on treatment. And that is not, you can't talk about comprehensive eye health if you're not talking about all the 4 aspects of eye care. And so, why are we emphasizing so much on eye health? Why is all this talk about eye health? Is it really an issue? Isn't just a few, group of people? Not true. According to a report by the WHO, out of the 7.8 persons living in the world as of 2020, it's estimated that roughly about 43% of them are blind. And out of those 43%, 55% of them are women. So it goes to show that when you're talking about eye health, there are a lot of inequalities embedded in it. Also, when you look at the prevalence of blindness, it's been found that it increases with age, such that up to 78% of persons that are blind are usually 50 years and above. And also 90% of those people that are blind live in low to medium income countries. That figure is staggering. Even me, when I saw it, I was shocked. And so it goes to show you that there is an issue within the whole concept of eye health. There are certain inequalities that are embedded in it that is making, these statistics to tilt towards people, of a particular category. In Nigeria, we have roughly about 1.13 million persons above 40 years of age that are blind and 3.1 million persons with low vision. Also, talking about inequalities, we also find out that 2 main risk factors for being blind in Nigeria is being not educated and living in a rural area. And so those things are things that should give us pause and consider that something, despite all the facilities that are out there, something is wrong. Some people are this eye health, this eye care is not getting to certain groups of persons. And so let's quickly take this poll question. This poll question is, how many SDGs do you think eye health impacts, whether directly or indirectly? Do you think it's 1? Do you think it's 7? Do you think it's 12? Or do you think it's none? And so, as we go on with the discussion, we'll find out how many of them. I think according to the poll, maybe, Eva, please, could you help us share the poll again? I think, yeah, I wanted to see the poll results.
Can you let me know when to end the poll, and then we can share the responses.
Yes, please share the responses.
Yeah,
thank you. Yeah. And so,
here we go.
Yeah, 29% said just once, 36% say 7, 29% says 12, and 7% of our participants says none. So as we go along, we'll find out how many of the SDGs really impact our health. And when we're talking about SDGs, we're talking about the Sustainable Development Goals. They're goals that are set up by the United Nations to serve kind of like a blueprint or a template to achieve a better and a more sustainable future for all. In total, there are 17 SDG goals. And out of the 17 SDG goals, 12 of them are either directly or indirectly impacted by eye health. For example, the first SDG goal is ending poverty. And it's been found that persons living with blindness or with some form of visual impairment are usually poorer and less likely to participate in work. When you talk about SDG 2, which is zero hunger, it's been found that 46% of households, after the breadwinners underwent cataract surgery, they were able to move up an income bracket, reducing hunger and increasing their household income. When you're talking about quality education, which is SDG 4, school-age children with visual impairments usually experience lower levels of educational achievement. And I'm sure I would have fallen into this category if I had not gotten my first pair of glasses. For SDG 5, eye health impacts is in the fact that women and girls are more likely to develop visual impairment and less likely to get treatment compared to their male counterparts. And so if you look at this diagram, I love this diagram, it just goes to show how much of an impact, directly or indirectly, improving eye health and reducing visual impairment impacts all the different SDG goals. We have SDG 6, where communities that has to do with access to water, communities that lack sources of clean water are prone to eye conditions. When we talk about SDG 8, which is inclusive and sustainable economic growth, adults with visual impairments have lower rates of workforce participation and productivity. SDG 10, just as we said in the previous stats, 90% of persons with blindness are living in a developing world. And so improving eye health will help to rebalance this inequality. When we talk about 11, which has to do with safe, resilient, and sustainable cities, it's been found that unoperated cataracts causes a chance of motor vehicle accident by 2.5 times. SDG 12, which has to do with sustainable consumption and production patterns. In the eye care field, there's some unsustainable consumption and production patterns. For example, you have a pair of glasses. When you finish using, for example, you go for your regular checkups, maybe once in 2 years or once a year, and the doctor says, "Oh, this glass is no longer your prescription." You ask what happens to the lenses that are taken out and the new ones put in. Most of the time, those lenses are just discarded and all loaded in a dump pile somewhere. And so eye health also has an impact on that. Then when we talk about climate change is my particular favorite because it's been found that with increased global warming levels, there is an increase of exposure to UV rays, and that also causes an increase in eye conditions like pterygium and pinguiculum and macular degeneration. It was a recent outreach my center did in a marketplace in Nigeria. Most of our markets are open air markets, and so we found an increase like higher than normal incidence of pteridium and pingueculum. And these are conditions that are usually stimulated and caused by recurrent exposure to UV rays from the sun. And these women sell in the open air market, they sell outdoors, so they are exposed to these UV rays. And so you see how eye care relates to climate change. And so it just goes on and on and on. If you go to SDG 17, talking about global partnership, we can't achieve vision for everyone until the different eye care professionals, optometrists, ophthalmologists, opticians, ophthalmic nurses, begin to work together. Because within all these, different career patterns, all these professions, there are a lot of rancor between them. And so until they begin to work together, we cannot, achieve vision for everyone. And so it just goes to show that eye health is so much more than just care of the eyes, and it has a significant impact on achieving the SDG goals because of the way it impacts each and every one of them. Out of 17, 12 of them are directly or indirectly related to eye health. And so how does SDG 3, which is the key one we're talking about here in this webinar, how does SDG 3 relate to eye health? SDG 3 has to do with ensuring healthy lives and promoting well-being for all at all ages. It's been found out that visual impairment causes, is associated with significant health effects, such as increased risk of the person suffering from falls and injuries and injury-related mortality. Also, mental health issues, persons with visual impairments at higher risk of that. Mental health issues like depression. There are also studies have found out that persons with visual impairments have reduced health-related quality of life, even more than persons that suffer from cancers and diabetes and hypertension. And so there's a significant relationship between eye health and being able to achieve SDG 3. Because if these issues are not addressed, we can't say we are achieving SDG 3. And so another relationship between SDG 3 and eye health, for example, universal health care. Universal health coverage is a key cornerstone in SDG 3 that has to do with everyone being able to access free or at least affordable quality health service without putting themselves in financial hardship. In this context, it refers to free or at least accessible, affordable quality eye health services. And so looking at this diagram, you see the whole relationship between visual impairment and general health. And so we can say we're trying to achieve SDG 3 when visual impairment is not put into consideration, when we're not putting into consideration eye health. And so it's very important that in our aim, in our goal of achieving SDG 3, we put in eye health, we put in visual impairment into place. And so how do people usually assess care? They assess care through the healthcare services, either the public sector or the private health sector. And embedded in the private and the public health sector, we have a number of, this debate that goes on, which is better. Is it private? Is it public? Is public is better because everyone can access care there. It's affordable. Private is better because they're more efficient. And so there's this debate that goes on and on between both sides of the divide. And so I'm going to look at it from the angle of public and private eye care in LMICs, and I'll use Nigeria as a case study. When you talk about public eye care in Nigeria, usually these centers are just like units or departments in a larger, healthcare facility. And so they're embedded in the hospital. They're not the primary focus of the health facility. It's just like a department in it. And the care there is usually not expensive because the government subsidizes, the care there. And not only that, the government is the one funding, the care in those facilities. Normally, we have what we call the NHIS, which is supposed to be be able to cater for persons that access care in the public health sector, at least 90% of the income of whatever you're going to spend there is covered by the government. But unfortunately, it hasn't really taken off in Nigeria. And so we have just like 10% of Nigerians registered under that scheme, and the remaining 90% of Nigerians still have to pay out of pockets for even when they access the public eye care services. And despite the benefits of the public eye care services, it has certain challenges. For example, they have not enough facilities, and the facilities that are existing are poorly maintained. There are not enough professionals, because most of the professionals are, for example, out of 5,000 optometrists, registered optometrists in Nigeria, 80% of them are in the private sector. Only 20% is employed by the government, because the government really is not able to fund salaries of these of optometrists in their practice. Also, out of the roughly 1,000 ophthalmologists in Nigeria, just about 1,000 ophthalmologists in Nigeria, roughly 50% of them are working in the public sector. But the public sector, funny enough, is not able to fund so many personnel. So when you come to the public eye care sector, when you come to a public eye care center, there are not enough personnel. Also, poor funding by government. For example, like Nigeria's annual budget, just about 4.2% of the annual budgets are allocated not to the eye care sector, but to the general healthcare sector, and just a very little amount of that trickles down to the eye care centers in public centers. And so there is inadequate funding by the government in this in the public eye care sector. And so what do people do? They look for an alternative. You can't go to the public, you can't get the care you receive, they're not enough. And so they switch to the private eye care. Private eye care in Nigeria employs like 80% of Nigerian optometrists and 50% of ophthalmologists. They're usually made up of full-scale centers that are either primary, secondary, and tertiary centers. So they are dedicated just for eye care. There are very few of them that are embedded within a general eye health center. Most of them, when you talk about private eye care in Nigeria, are full centers on it. So all their focus is on eye care, and they are drivers of innovation. You see the most latest technology when it comes to eye care there. You see, high-tech facilities there. And so they're really, really, well equipped. Most of them are well equipped. But despite the benefits, it has two major challenges. Number one, they are quite expensive. And number two, they're usually clustered around urban areas. And so we have a group of persons that cannot be taken care of by the private eye care sector. But funny enough, there's a category of people that you expect, since they can't afford private eye care, they will go to the public eye care. But funny enough, they don't go to the public eye care. Most of the time, they just wing it. They just stay at home. For example, someone that earns, I'll just use this analogy, someone that earns like, she's a market woman. When she sells in the market, she earns maybe 10,000 naira a day. 10,000 naira is roughly about $100. And she has an eye issue. And she goes to a private eye center and it's expensive. They're saying, registration there is roughly 10,000 naira, which is equal to what she will earn in the whole day. And then she said, okay, let me try the public eye care center. And she goes there and she finds out that because there are not enough personnel, there's a long waiting time. She will have to spend the whole day there. So whether she goes to the private, she was going to spend her whole $100 she will earn that day. If she goes to the public eye care center, she's going to lose the $100 that she will earn that day in the market. And so she doesn't go to any. She just stays in the market and says, don't worry, the eye problem will go. Or she'll patronize some, local, form of health remedy. And so there's a group of persons that are torn between the public and the private. And those group of persons, they're not small. They are mostly persons in the informal sector, persons who they are not registered under NHIS. They cannot, sacrifice the time they will spend in the government hospital, and they cannot afford private eye care. So there's a there's a disparity. People, even apart from those that can even afford, they're torn between, do I go to public, do I go to private? And that's wrong, because people should not be able to or access care because they can afford it or because they cannot afford it. People should be able to access care because they need it, not because they can afford it. Not because they can. When I talk of afford, I'm not just talking about money. I'm also talking about time. Because if you go to the public, you have to pay something, which is the time you will spend waiting. And so people should not be torn when it comes to accessing eye care within, I have to sacrifice something. People should be able to access eye care because they can. That is the bedrock of when we're talking about UHC. Everyone should be able to access eye care without, getting into financial difficulty. And so it means, with all this, it means that the private sector really is not all, how would I call it? It's not the key. It's not the solution to all the problem. It's not the solution to people being unable to access, eye care services. Yes, they deliver roughly about half of, Africa's healthcare products, the eye care, the healthcare private sector, and it has brought about increased access to quality eye care, because prior to, private eye care coming into Africa, coming into Nigeria, there were just a few government hospitals that had, an eye center. I think in Lagos, as large as Lagos is, we had just roughly about maybe like 2 or 3 centers that were able to provide eye care services. And so it brought about, private eye care brought about an improvement, but it's not the solution. What is the solution to achieving SDG? What is the solution to achieving UHC for persons who need eye care? This is the solution. Private and public healthcare being able to work together and partner together, bringing together their disparate, strengths together to work together to achieve better eye care for everyone. And so, yes, private eye care is a key to achieving SDG 3, but it is not the key. The key to achieving SDG 3 when it comes to eye care, eye health, is partnership between both the private, both the public, and even NGOs and civil organizations. And how can this work? First of all, we need to move the debate from being, okay, public healthcare is the best. No, private healthcare is the best. And we need to start looking at what is it that we want to achieve. We want to achieve affordable and accessible eye care for everyone, and focus on that while we work together. We need to private eye care and public eye care and private eye care need to start to address issues of affordability, need to address issues of quality, need to start to work together to address issues of affordability, availability of care, because each of them cannot achieve these targets that we have set for ourselves. They need to start to leverage on their strength, leverage on their reputation, leverage on their areas of, their skills, their resources. There are certain things that, public eye care can almost never provide. And there are certain things that private eye care cannot do because of the uniqueness of, their position. But when they come together, they are able to achieve it. For example, and how would that happen? People need to, these sectors need to start making changes in the way they look at things. For example, the NGOs and the public sector need to stop looking at the private sector as a rival. They are not your rivals. They are not, let's not demonize them. Yes, they have bills to pay, but they are not your rivals. They're your partners. They are the people that you work together with to achieve that goal that you want to achieve. We need to start looking at, the private sector as their partner, as, let's work together to achieve this goal. While the private sector also needs to start to make changes, they need to start looking beyond profits. Yes, you need to make a profit, but we need to start looking beyond profits to care. Think of ways to come up with products and services that people can, readily afford. For example, there are people living in rural environments that the private sector has not been able to reach out to. People in the informal sector, people living below the poverty line. They need to start looking at ways, coming up with, marketing strategies to target these people. Financial models that will reduce costs so that these people can actually access care. They need to leave their comfort zone of, just sitting down in your clinic and waiting for, patients to come in. The private sector needs to start to make those changes. And there was an article I read up on, and it just goes to show that even, the WHO is looking at the importance and the relevance of the private sector. The WHO came up with, a couple of steps that the private sector role that I can play in achieving universal health care. And so it just goes to show that private eye care, which is part of the private healthcare sector, has a significant role to play in achieving universal healthcare, in achieving our SDG goals. They need to start incorporating, the principles of UHC into even their normal business practice. It will require, a whole new way of working, a whole new way, a whole new approach from both sides. It is possible, as long as, emphasis is made on partnership, and our focus is on our goal, our ultimate goal, making eye care, making healthcare, making eye care in particular affordable and accessible to everyone everywhere. And luckily enough for me, I've been able to use my skills to be able to bridge the gap between the private eye care sector, where I work in primarily, and public health principles. Bringing public health principles into, the private sector. It is possible. And you will still make your profits. It is possible. And so, for example, the center where I work in, we do a lot of eye screening and eye health education activities. We go into the open air markets. We go into some really interior villages. And we've been able to, put those public health principles, engage the community, let them take ownership for it, let them see the importance of, their persons, the people in their community, receiving eye care. Even in our day-to-day practice, we put in public health principles. Also, I've been able to conduct, research regarding, eye health, excuse me, eye health related research work, and also carry out some eye health promotional activities. Also, of recent, thanks to the Commonwealth Scholarship Commission, their alumni body, they have what we call the ASEF program. Oh yeah, okay. This is one of the pictures of where we went for an outreach. So you can even see at the background, it's like a marketplace proper. It was in the middle of the market. We were literally carrying out this eye screening because the women were not ready. They were not ready to leave their shop. So we had to literally go in front of their shop and check their eyes one after the other. And we're also even able to provide, glasses and drugs at a reduced rate. As I said, partnering with pharmaceutical companies that were able to give us eye drops at reduced amounts. Some were even able to give us at no cost. And so these persons were able to receive care. And this is all about putting public health principles to work in private practice. Well, when it came to glasses, what we did was that we had a kind of like a glasses drive at our center so that people could donate their old glasses. And so what we just did was that when they donated their old glasses, we removed the old lenses from inside and put in, prescriptions for persons that needed glasses. And so we didn't have an additional cost of trying to get a frame for an individual. And so we're able to give out glasses at less than $5. Meanwhile, under normal circumstances, full-scale glasses can cost as much as $100 and above. You get my point? So using those public health principles, it's possible to put it into the private sector. It's possible to put it into private eye care. And we were able to achieve that at my center. Also, I was able to, at conferences, talk about public health related eye issues, and that is also me trying to bridge the gap between the private sector where I work in and the public health principles that I learned during my master's program. So I was talking about the CSC. They have a fund called for alumni. alumni of the Commonwealth Scholarship Program. And it's an annual fund that the Commonwealth Scholarship Commission gives to alumni that are involved in community-related activity that has to do with key developmental issues. So for this year, one of the themes for the ASEF program was Sports for Development, Equality, Diversity, and Representation. And so I had an opportunity of my activity being sponsored by ASEF, and my activity was on increased societal inclusiveness of visually impaired persons through inclusive sports. And so what happened was that what even made me think about this program was, as I said before, I have a daughter that's autistic, and we've had significant challenges, including her, into normal society. We've had some blowback from places of our community, for example, like our church and even school, because she's attending a normal school. I've had, difficulty getting people to understand that even though she has this challenge, she's still able to contribute, actively, she's still a part of society. And so when this the ASEF program came up, I thought about what are persons with visual impairment, how do people in the general society look at them? Most persons in Nigeria, once they see someone with visual impairment or any form of disability, you just tend to keep them in one place. You just tend to, put them aside and, just kind of, ignore them. And so I thought about it, how do we bring about inclusiveness in our society when it comes to persons with visual impairment? And I decided to work with secondary school age students because they are our future. They are the ones that will build the society, the future, the kind of society that we want. And so I worked with secondary school students that are visually impaired and secondary students that are normally sighted. We carried out a sensitization workshop for them on visual impairment and how we can make a more inclusive society for visually impaired persons. And at the end of the workshop, we also, in order to drive engagement, we conducted a sporting activity that involved both the visually impaired students and the normally sighted students. And it was really exciting. You understand? It was when the visually impaired students started to talk, you can actually see the surprise on the normally sighted student. They were impressed. And also the visually impaired student, by the time the normally sighted students started to engage with them, they were encouraged, because they got to see that despite the fact that they were visually impaired, it really doesn't matter once people see what you're capable of doing. And it was really very interesting. It was engaging. These are pictures. This is one of the pictures from the workshop. And after the workshop, they then engaged in a football match. So you can't even tell, looking at this picture, you can't even tell those that are visually impaired or those who have normal sight. There's no difference between the two groups of persons. So because both groups of persons were blindfolded. And so it was interesting to see. And even after the program, they were talking together, they got to know one another, and it just went to show that it is possible to have an inclusive society. Society doesn't have to be one that you keep persons with visual impairments to one side and you keep persons with normal sight to one side. Our society can be all encompassing. And so also in the course of the project, I'll just talk a little bit about my scholarship experience. I got my Commonwealth scholarship at, it was a distance learning program in 2017. What was so fascinating about it was that the program, the classes started in September, and in August, I gave birth. And it was a roller coaster ride. And why I appreciate the distance learning program is because I didn't have to leave my baby and I didn't have to stop my studies. I was able to combine both together. While doing my studies, I was still able to take care of my baby. And I'm sure if I had an on-site program, I probably wouldn't have had to be able to do that. I'd have either had to leave my baby, which would have been impossible because she was less than a month old, or keep my program to a side. And so I really appreciate the opportunity that the distance learning program gave me. Apart from being able to still be able to take care of my baby while I was doing my master's program. I was also able to interact with persons from different parts of the world. I had classmates from Bahrain, I had classmates from Uganda, I had classmates from Bahamas, classmates from all over the world, from the US, from the UK, and we're all collaborating, to carry out our master's program. It was interesting because most of us, as at that time, we were working at the same time while we were doing this master's program. And so you could hear something in class, you could learn something in class, and quickly, immediately, the next day, you're able to put it into practice. And so you can actually see in real time how the whole program was going. We didn't have to wait and say, oh, after our 1 year or 1.5 year master's program, let us start putting these things we've learned into practice. But in real time, we're able to put what we learned into practice at the same time. And that knowledge and those skills, that I acquired during that master's program is what is driving me now, is what is allowing me to really put, public health into, the private eye care sector that I work in. And so of recent, I had opportunity to go over my scholarship essay and, those things they tell us to write when you're applying for the Commonwealth scholarship. And they say, what were you doing 5 years from now? What will you do with your degree 5 years from now, 3 years from now? And funny enough, when I looked over what I wrote, this quote is a direct copy and paste of what I wrote. And I found out that all those things that I wrote are what I am achieving, are what I am doing as at this time. I am doing almost exactly word for word, what I wrote in my scholarship essay. And this is a direct copy of this. I was talking about, being able to do a master's program in public health. And I said, this is important to me because I want every patient to have access to comprehensive ocular health care at an affordable price. And for me, that is what all this is about. That's what my career is about. That's what my master's program is about. That is what has driven me so far in my career and what has driven me in my public health career, being able to make sure that everyone is able to access comprehensive healthcare at an affordable price. And I will encourage all alumnus and even scholars. For alumnus, go back to what you wrote. I don't know if you have access to it, but me, I had the Word documents of what I wrote there. Go back to it, have a look at it, and ask yourself, am I achieving these things? Have I been able to achieve these things? And you'll be surprised. If you look at it, you may already even be doing those things that you said you were going to do, or maybe you were not. And so it's an opportunity for you to put those things into practice, to look at them and re-strategize and start to achieve those things that you set for yourself. And for scholars, don't think that those things you wrote are just just for writing, like, oh, let it be that I wrote something, that kind of thing. Let me just put something down. They are things that can drive you, that can remind you where you're coming from and where you want to go to. For me, it's being able to, provide accessible and comprehensive healthcare at an affordable price. For you, it might be something different. But it's something that all of us should work towards. And funny enough, this is not something that just has to do with people in the healthcare sector, people in the eye care sector. Even you in your own different fields, you have a role to play. By talking to people about, you need to take your eye health seriously. You need to assess care. Oh, you can go to this, you can do this, you can do this. Talk to people about their eye health. And ultimately, it's for the benefit of all of us. I hope, and I think on that note, I will end my, webinar. I hope I was able to pass something across. I hope we're able to learn something from my talk.
Hey, thank you so much, Dr. Omojeme. That was so inspiring. I hope this is the time in the year where we have new scholars joining in and starting their studies. So I hope they are inspired if they have joined this webinar. I hope you feel inspired by Omojeme's statement in her essay that she wrote while she was applying for the scholarship, and how she has looked back at that statement, and she's proud of the fact that she has managed to achieve so much within the field. Thank you, Omojeme, for your brilliant presentation. I would now like to open the question and answer session if you feel ready. Um, as I said, we have received a few questions in the registration form, so I do have a list of questions to begin with. But for attendees joining, please send in your questions in the chat box and I'll make sure to raise them with Jemmy. All right, Jemmy. So the first question is from a current scholar who has mentioned that they are totally blind as a result of glaucoma. And they've said that glaucoma is one of the leading causes of blindness in Africa, which you may be aware of. To curb the devastating effect of glaucoma, people need to be enlightened on the importance of regular eye screening for early detection. In your opinion, what is currently being done in Nigeria to ensure that the unsuspecting populace do not fall victim to the silent thief of eyesight? Also, how affordable and accessible are private eye clinics for the common man in Nigeria? I hope I was audible. If I wasn't audible, let me know and I can put the question in the chat box for you.
Oh, okay. Yes, you were audible. Thank you, Eva, for that question. Yes, very true. Glaucoma is one of the leading causes of blindness in Nigeria and in most LMICs. Most of the time, it's because, first of all, glaucoma really doesn't have any sign. And so persons usually go on years without knowing that they have an eye issue. I've had patients come in and don't know they have glaucoma. They just came for, oh, my eyes, I just want to have a checkup. And we see that they have advanced glaucoma. And so one of the major problems with glaucoma, as I said, is because glaucoma most times cannot be detected until you go for a checkup. So you could be walking around with 70%, 80% of your nerves completely damaged, and you're seeing clearly. Persons with glaucoma can actually have very good straight-on vision, but their peripheral vision is gone. And so that's one of the reasons why, glaucoma is most of the time in LMICs are not detected early enough, because we don't have access to, screening programs that will emphasize the need for persons to go for regular checkups. You cannot know you have glaucoma sitting in your house. And so what is currently being done to ensure that people don't fall victim to the silent thief of sight, which is very true, is, as I said, there is need to put in public health principles into practice. The truth is that those of our colleagues working in the public health sector really cannot leave their center and start going to do eye screening exercises outside, because they are already overworked. There are more than enough patients for them to see indoors. So to say let them go outside and just start screening people is almost impossible. And so it honestly now falls on those of us in the private sector that have a little bit leeway of time to go out there and screen people. And also things like the World Sight Day that we're celebrating today, most eye clinics are providing free eye screening services. So even though the person is not, we don't have any problems, if you don't have any problem, go and get screened, walk into the nearest eye center close to you and get screened. And so a lot of eye clinics are providing, free eye screening services. And so that's what's currently being done. There are a lot of research also being done, regarding, glaucoma treatment protocols and, glaucoma management protocols. So a lot is being done. It may not be exactly in the public space, but at least as far as screening is going on as is concerned, a lot is being done by both the private, the government, to an extent the government, but a lot is being done with the limited resources that is available to us. And also ask how affordable and accessible eye clinics for the common man in Nigeria. On an average, eye care services registration in an eye care services center private can range from anything from $100 to $5. Okay, maybe not, $5. It can range as much as that. Find a center that fits within your pocket. For example, like where I work, we have two centers, one major center and we have an outreach center. A major center registration usually starts from like roughly, let's say $10. But at our outreach center, registration can be as low as $2. So for someone that is living below $1 a day, you might be able to access our outreach center, be able to access the main center, but at least the outreach center, you may be able to access that. So it depends. You have to go out there and ask and find out centers that fit into your pocket range. And also, when outreach programs are being organized, you can also take advantage of those free eye screening exercises.
Thank you for your detailed response. I'll go to the next question. So what hinders governments, especially in Africa, from investing in public healthcare?
Number of things that hinder government. One of the key things is they really don't see how important it is. I'm sorry to say, but for me, that's what I think. They don't see the relevance of eye care is to them as individuals, to them as the country. What difference does it? Eye care. What difference does it make? So I don't think they see it as a. Most of the people in government. Okay, when we're talking about public health care, when we're talking about the people in government, the people that actually are able to make, these rules, trying to increase funding healthcare services, they don't access care in Nigeria. They go abroad for their healthcare. They're flying out of the country every other day to access care. So they don't see it as a priority because they don't use it. We are the ones that use it. They don't use our private care services. And so it's not a priority for them. I think if a policy is put in place that all government officials need to cannot go out of the country for healthcare services. They need to use the healthcare services that are within the country, except under some very special conditions. I think we'll see an improvement in our public healthcare facilities. If you are going to use that service, you make sure that service is good. You will increase funding for that service. You will make sure that the funds that are going into that sector is being used for what is supposed to be used. If you're not going to use it, you couldn't care less. It's just like the private eye care centers. Why is it that the private eye care centers are doing well? Because the owners want to make profit, because they know they're in a business, they know they need they need this business to work. If the government saw the private health, the public health care centers as that, we won't be talking about insufficient funding for public health services. So that's what I think. They don't use it, so they couldn't be bothered. I could be wrong, but that's my own opinion.
No, that's a great response, Jemmy. And I think just to back it up, I did see a message in the chat box. Sorry, I'm just scrolling through. A million positive acknowledgements of your presentation, but there's this one message I've seen. I will get back to it. Anyways, there are a few questions on the age-old practices being followed regarding eye health care. So, for example, one question is around what is the effect of breast milk on a child with conjunctivitis, as mentioned by local women in Ghana. I'm sure you would have seen such age-old practices in Nigeria as well. What are your thoughts on it?
For me, when it comes to things like this, I like us to look at it from a common sense aspect. Someone has conjunctivitis, you have an infection. Breast milk is very rich in nutrients, and you have an infection, and you give it additional nutrients by squirting the breast milk into the eyes. What do you think will happen to those microorganisms? They will flourish, they will grow very well and cause a lot of damage. I had an experience of someone, this wasn't even breast milk, this was her urine. And this was back in school, and she had a red eye, and her roommates told her, oh, put in urine in your eyes, that your early morning urine, you just put it in and it will really help. And meanwhile, this girl did not know she had gonorrhea. Gonorrhea in females is not as obvious as that in males. And so she put in her urine, and the eye got redder. And she put in her urine the third day, and she kept putting in the urine till the infection went so far that it perforated her cornea. Thank God it was just one eye. She had the red eye in. So at least we couldn't save that eye, but at least the other eye wasn't affected. And so we need to, I don't like to, just, tell people, oh, forget about it. Look at it from a common sense aspect. It's an infection, it's an organism, and they're giving it very rich breast milk that is good for babies. Breast milk is good for babies, it's also very good for microorganisms. So think about it. So when you try, talk to people about these things, let's look at it from a common sense aspect. It helps to get the message across than, trying to belittle them and say, oh, don't you know, think about it, but just sort of see, this is this, this is this. So please, all those practices are things that look at it from a common sense aspect. And if you look at it from that aspect, it really doesn't make sense. It's really not healthy. So please, they should be discouraged.
And just to add to that, I would say consult your doctor, consult your optometrist, consult the physician. But thank you for your response. I did spot the message. The message is from Daisy, and they said, thank you for your presentation. And they're from Uganda, and they said that they're glad to see that many clinics in Uganda are coming out to offer free eye checkups. And because of this, they themselves have recently got the courage to get their eyes checked out, and they had blurry vision for almost 2 years. So it all goes to, talk about the public health system and the interventions that are available to the public, to the general public. So moving on to the next question. The next question is about your eye care facilities, and if your eye care facilities are up to date as per Nigerian standards, and is medical facilities equipped to help recover any type of eye discomfort?
Well, when you're talking about eye care facilities, it really, if we're talking about the government hospitals are really trying. I have to give that to them. They may not have all the high-tech facilities, but they usually have the basic. And if there's need for further examinations, like my center is really close to the teaching hospital in Lagos, and so for those facilities that they don't have, they send patients down to us to do those examinations, and they take the results there. So they're walking around with whatever they are provided, and so even if that center doesn't have it, they usually will refer out. Most eye care facilities are severely regulated, and so there are key things that they usually should have, and those things, the key things where you're talking about, okay, basic eye care services, they're able to provide that. If they can't provide that, usually they will refer you to another center to get those tests and those procedures done. So yes, most of them are up to date. My center and most tertiary and secondary, eye care centers have laser facilities. They have, so even the laser that have been done in the UK and the US, we do that in my facility and some other facilities here in Lagos. We have, they're really trying, despite, because most of those equipments are brought from the UK or from the US. And when you think about the dollar to naira, ratio, you're really spending a whole lot. But most eye care facilities, they're really trying, despite the constraints of cost, they're really trying to make sure that they have the best. And even if they don't have, they usually will and should refer you out to do those tests, then come back with the results to get the best care.
Perfect. So we do have, I know we're running out of time, but I would like to raise one last question that's in the chat box. And the question is, what is the effect of diabetes in getting diagnosed with glaucoma? Is there a cure for this? That's the question.
Sorry, could you repeat that question again?
What is the effect of diabetes in being diagnosed with glaucoma?
Okay.
Is there a cure?
Okay. It's not as if diabetes has a direct impact on glaucoma, but there are comorbidities. So if someone has glaucoma, you have your optic nerve has been damaged to an extent, one extent or the other, and you have diabetes. And someone with diabetes runs the risk, if it's not properly managed, if it's not properly controlled, runs the risk of developing what we call diabetic retinopathy. And that's a case where the blood vessels at the back of the eye starts to leak or bleed out, fluids, which is not supposed to, because the diabetes is not well controlled, because the blood vessels, the walls of blood vessels become porous. And so you already have glaucoma you're dealing with. Then you have diabetes that is not well controlled, and the person is bleeding at the back of the eyes and has the optic nerve damage. So it complicates the management of both conditions. And so it's very important, as someone that has glaucoma, you make sure, if you have other issues like diabetes and hypertension, they can have, if those two are not controlled, they have direct impact on the eye and can complicate your management of glaucoma. So instead of you and the doctor battling just the glaucoma, you're battling glaucoma effect on the eye, you're battling diabetic effect on the eye, you're battling hypertension effect on the eye. So it's really very important when you have eye conditions to make sure your systemic, health conditions are well controlled. Before we end, I noticed there's quite a lot of questions on vegetables, regarding eye care, what to eat, what to do regarding, eating healthy. When it comes to the eyes and, what to eat, the brighter, the better. When we talk about brighter, the better, the more colorful the fruit is, the more colorful the vegetable is, the better it is for your eyes. I'm not going to go into the whole complicated, this micronutrients in there, but the brighter the vegetable is, the better it is for your eyes. Things like carrots, things like yellow pepper, the brighter, the more bright the color is, the better it is for your eyes. But that doesn't mean you shouldn't go for your regular eye checkups, because fruits and vegetables are not going to stop glaucoma. They're not going to prevent glaucoma. They're not going to treat glaucoma. They're not going to sort out eye health issues. Please go for your checkup at least once a year. At least once a year, you should go for regular eye checkups.
Thank you for responding to the messages and the chats that came up. I know I may have missed a few, but I'm also concerned that we have run over time with the webinar time. So with this, I would like to end the Q&A session. However, I would like to let you know that Omojeme has agreed to answer to any queries you might have, either via email or LinkedIn, and her email address is and LinkedIn name is on the next slide. Yep, there you go. So yeah, if you are any scholar, if you're an alumnus, if you're working in the sector or public health, or in general, if you're just curious to know more about eye health and would like to connect with Dr. Omojeme, please feel free to send her an email. She's also happy to respond to any questions that we might have missed today that have come through in the chat box or the registration form. So yeah, please do feel free to connect with her. Before we end, would you like to summarize in one or two lines about the webinar topic, Jeremy?
Yeah. What I would just like to say is that we all have a role to play in making sure we keep our eyes healthy. Just like World Sight Day says, #love your eyes. We have a role to play for ourselves, for our family, for our communities. In different ways, you could offer to provide maybe you know what, this person has eye issue in my village, or this person has an eye issue in my family. This is an opportunity. I will pay for the person's transportation to where they can get the best eye care service. That is my own contribution to making loving my eyes. If you are in government or in a place of authority where you can actually influence policies, you can talk to them. Oh, what do you think? This eye health thing, let's prioritize it. Let's not just put it aside. It's quite important. In our own little ways we can do that. Or you see someone that is doing the wrong thing, as we talked about, putting breast milk in the eyes. Madam, don't do that. You can talk to them and explain to them that this. So we all have a role to play, and all this contributes to us achieving SDG 3. each one of all these our actions are all contributors to making sure HTD3 is possible.
Brilliant. Thank you so much for your wonderful presentation, Dr.
you.
Omojeme. I hope our attendees found your presentation useful and insightful.
I hope so too.
And thank you so much to all our attendees for attending the session. And
Thank you.
I've seen a note in the chat box where someone said that it was very inspiring to hear about your Commonwealth Scholarship essay and the statement and how you've gone back to it and looked at your journey so far. So thank you for sharing that. And as I've said, there are many positive messages about acknowledging your presentation. So on behalf of everyone who have attended this webinar and on behalf of the CSE alumni team and the wider CSE community, thank you so much for presenting this webinar.